Hello, welcome to Psychology Matters, and we have a wonderful episode today. I'm pretty excited about this episode. We're going to talk a little bit about trauma, and we have Clay Harris back with us again. We've had Clay before.
Yes, thank you.
And Clay, you are the program manager for the Mental Health Cooperative.
Yes.
You travel around Middle Tennessee, do you not?
I do.
Yeah. Oh, that can be a lot of work, traveling around. We surely are glad to have you here today.
Thank you.
To help us understand really what trauma means, what trauma is, the kinds of things that you guys do and you do to treat people who have trauma. So maybe a good place to start would be, just explaining what is trauma. What do we mean when we say trauma?
That's a great question, and really probably the only place to start when you're talking about trauma. Trauma can be very complicated, but realistically speaking, really what it means is when there's an emotional disturbance to an event or act. So it might be something natural, such as a flood or a hurricane or something like that.
Like the flood that Nashville experienced.
That's right.
That was traumatic for people.
Absolutely.
Yeah. Okay.
Or something man-made. It may be abuse or a car wreck or something like that. The interesting thing about the word trauma is the Greek translation is wound. And so the Greeks use that word for the physical body in regards to trauma being a wound to the body.
Okay.
But the easiest way to understand what trauma is in our world of mental health and psychology is just to recognize that the word trauma, when we're thinking about the brain, means a wound to the brain.
Okay.
And so you can make the subject matter very complex, but when you boil it all down, really trauma is when something happens, an event occurs in our life that creates a wound to our brain.
So it's not necessarily the physical wound to the brain. It's how the brain is the emotional damage, the emotional hurt, the emotional wound.
Right.
Okay. So, all right. So I think we understand that, trauma. And what you work with, you do a lot of work with adults who have suffered some sort of trauma. Would that be trauma that's happened recently while they were an adult? Or could it also be something that happened when they were a child that is now affecting them, and you would call it trauma?
Great question. Many years ago, when trauma was discussed, there was really only a very small carving of who was probably affected by emotional trauma.
Okay.
What we now know in the field and where our field has progressed over time is that really trauma is many, many, many things, and not just, let's say, those who have experienced war or something like that, where that might have been kind of the only time that people talked about someone struggling with trauma. Now it's at a point where when you think about the definition of trauma being an emotional disturbance that causes emotional difficulty, we've probably all had something traumatic at some point. And so it's interesting how it's evolved over time from what we thought few people had to recognizing what many people may struggle with at times. And so when you look at it from that perspective, you come back and say, well, trauma could have been something that happened many, many years ago, or it could have happened very recently. And really there is no right or wrong or good or bad on when something traumatic occurs. So it could be anywhere on that timeline.
So I could have been a child and I could have suffered some sort of trauma. I don't know, let's say abuse, whether it be physical or sexual, but I could have had that and not treated. I think a lot of people go through life and they don't talk about things, they don't work through, they just do the best they can, they cope.
Sure.
and then in later years, I'm an adult, is there a chance that that experience then could be classified as a trauma that's still unresolved if it's getting in the way, maybe in my own relationship or in how I'm dealing with things in life right now?
Yes, that is certainly one of the ways that that can progress and play out
Okay.
over the years. If you really think about what trauma is and what it does to our brain, it could have been an event that you didn't even recognize was traumatic, but it could create a pathway of thinking that influenced how you developed. And oftentimes we hear people say, that's just who I am.
Yeah.
And they have found a way to categorize who they are as a result of their experiences. And so it may not have been something that they view to be traumatic to them at a certain age, or they might even recognize that it was difficult, but they have not potentially seen how that is affecting them now.
Oh, okay. Well, let's say you have someone that does come in and they're confused. So they come into the counselor's office, and through conversation, which, I mean, counseling and therapy is a lot like what we do here, conversation, just talking things out. It comes out that they really are suffering from trauma. What kind of things would you be doing to help this person? What would you do?
We would typically go through some initial phases. Just generally in counseling, you would begin in that engagement phase and information gathering. We would be developing that relationship and understanding who the client is as a person, or who you are as a person, understanding kind of the timeline of the events that may have occurred in your life and your perception of how it has potentially affected you. At some point, we could then begin to identify maybe some categories. Oftentimes people come in and they say, I've got, a ton of things wrong with me, or they see or feel that they think that they have so many different problems. But what we often find is that really there are categories, and they really only have about one or two major struggles that actually lead to multiple symptoms. And so in the world of trauma, you're often looking at what is called negative thoughts.
Oh, yeah.
And so when you think about negative thoughts, oftentimes when you have an event that occurs and then you have a negative thought that forms. So
about yourself or about the situation that's happening right now?
Right. You typically have about 4 different categories. It may be something along the lines of value. It may be, which might mean I am worthless.
Yes.
Or I'm not good enough. Another category is responsibility. It's all my fault. Another category is control. I have no control. Another category is safety. I feel unsafe. And typically you begin to recognize when someone may be listing symptoms out that are a long laundry list of things they feel that are wrong with them. You really begin to see, wow, I can draw a line and say, doesn't that fall into that category? Doesn't that fall into the same category? Wouldn't that fall into the same category?
Right.
And so you may have someone who says, well, this is just who I am, but you quickly can begin to identify that event, whatever that may have been. Could that have potentially caused this negative thought? And could this negative thought then be something that is driving these behaviors?
What you do, it's not who they are, it's what they're doing.
It's something that's developed as a result of that event.
Okay, so I'm remembering a case where a gentleman came in who had been robbed, okay? He was robbed at gunpoint. His store was robbed, and there was more than one gun on him. It was pretty dramatic, and he pushed through. He continued working after that. Didn't seem like it was that problematic as far as moving on. A year later, his neighbor was robbed at gunpoint, and he couldn't go back into his store. So what would you say about that? What's going on with him? And then I'll tell you what we ended up doing with him, okay?
So just based on the limited information, the first thing I would be thinking about out of those categories potentially that I listed is where is it kind of ringing a bell and fitting into a certain category? And so the first thing I would be attempting to evaluate and wanting to explore more is, does that individual struggle with a sense of safety? I typically say, when I say the word "I'm unsafe," does that fit? Do you identify with that thought? And sometimes it can seem complicated, but really when you think about the negative thoughts that occur, there's only so many negative thoughts any of us have, regardless of when the events change or how it changes. And so you can oftentimes pretty quickly identify what category that individual may be struggling in. And so then once it's identified, okay, we now know that we're struggling in the area of safety.
I think you're right on it, because he ended up putting all kinds of security on his home, which was not located in the same area as where the event had happened.
So one of the things that happens in the brain is almost like this rewiring, is that when we have an event that occurs, one of the symptoms that can happen is irrational thoughts. And so with irrational thoughts, although someone can be in a safe environment now, their brain may be sending these signals saying, "I'm unsafe, you're unsafe, you're unsafe, you're unsafe." And their rational thoughts would say, "I'm in a home, it has an alarm system, I've checked to make sure there's been no break-ins in the area over the past 2 years," but their brain is just telling them that they're unsafe, and they may even experience physical symptoms. They may have a rapid heart rate, sweat,
night terrors,
anxiety, other symptoms that may rise out of that situation.
Well, what we ended up doing is offering him something called EMDR. So do you want to share what you know about EMDR?
Sure. I'm level 1 and level 2 trained in EMDR, and it's eye movement desensitization and reprocessing.
Okay, it's a mouthful.
It is, and it's probably just a fancy way of identifying that there are multiple ways to access the brain outside of verbally talking about things. And so what science has shown and been a part of helping us learn is that oftentimes when our brain is using the parts of the brain necessary to speak, it is unable to, at the same time, use the same parts of the brain to reprocess old stuff. And be able to potentially bring healing to events that your brain needs that extra capacity to look at and work on. And so sometimes what we know about trauma is that trauma is not always best treated by verbally talking through that. And so you'll often hear people say, well, people have just told me to talk about it and then it'll get better. And they often say that hasn't worked and doesn't work for me. And some people it may, but some people it may not. But what we know about science is that it says that the brain doesn't typically do those two things at the same time. And so what we know about sleep is that brain activity from science shows that there is a high level of brain activity while someone is sleeping, and at the same time that high level of brain activity is taking place, their eyes are moving back and forth, even closed are moving back and forth, which is called rapid eye movement.
I think we've seen that in people sleeping. You can see that movement underneath the eyelids.
That's right. If someone were watching somebody, you might be able to tell that that's happening, but we do know from science that that is happening when people sleep at a certain level where they reach REM sleep, rapid eye movement, and that is also tied to high brain activity. And so we are utilizing a method of accessing the brain at one of its highest levels to be able to assist someone in reprocessing old stuff. I like to call it old stuff just because everybody can kind of figure out what old stuff is. We all probably have a little bit of old stuff that we can quickly kind of connect to.
Yeah.
And so
A nicer way of saying old trauma.
old trauma, yeah. Old stuff just makes sense.
Yeah.
And that's something that has been very effective in treating trauma.
Does that take a long time?
It actually takes far less time than many people realize.
Wow.
And in working with individuals with trauma, oftentimes you find a very common link that people avoid dealing with old stuff. They would tell you that they have old stuff. They could
That
identify.
they've dealt with it, that they have dealt with
They
it.
may tell you they've dealt with it. They may think they've dealt with it, or they may tell you, I'm not dealing with it.
I'm not going there.
I haven't dealt with it. I will one day. And oh, if there was one thing that people could see on the other end, is that dealing with it appropriately and in an effective manner is so much better than suffering with the symptoms that it causes over the course of time.
Such a relief.
It can be a life changer.
It would seem like that's something that could be addressed in just a handful of sessions, that it's not necessarily a long-term.
I like to think about things in other aspects sometimes to conceptualize. And so I talk about automobiles sometimes, and I talk about the physical body. And so we may have a physical injury that is pretty bad.
Yeah.
But what science and technology can do, and medical, the appropriate things medically, can help heal some really difficult wounds that we may have on our body. If we have a cut on our arm that's really pretty bad, the right interventions and the right medical treatment can help to resolve that fairly quickly. We go, wow, that healed faster than I thought.
Yeah.
Or if we have a vehicle, I don't know much about fixing engines. I know a little bit, probably to get myself in trouble, but I don't know enough to fix something if it happened major. And so where I might think that it's too difficult to solve that problem and I should just sell my car, a mechanic may say, actually, if we do the right treatment to it, if I can provide the right parts and take the right steps, it's actually not that bad of a fix. And then you can have things back to the way that you would hoped they would be.
So it seems like one of the things that you're alluding to is it can take courage for some people to deal with the trauma, or it may take courage. Others, they want to deal with the trauma. They want to jump right in. But for some, it's a hard thought, to go there, and they push it down, and that's what causes those behaviors or those reactivities, symptoms, yeah.
Right.
So it's courage, and yet once you do it, there can be great relief.
Absolutely.
Okay.
Trauma is treatable.
Trauma's treatable. That's another good phrase. We were talking about good phrases earlier. That's a good phrase. So let's just imagine that there's something that would be really good for, our audience to know about trauma or seeing a counselor in trauma. How do you know who to go see? How do you know how to explain your problem? What would you tell them generally?
I think that's probably a two-part
Yes.
answer. The first part being, how do you know that it's something you need to seek treatment for?
Right.
And then what are the potential ways of seeking treatment?
Right.
Or who would you look for? I think the first way, most of the time, the easiest ways for me to help people identify that is that when your life becomes unmanageable, or the symptoms become unmanageable, that's probably a good indicator that it's reached a level that your old stuff or old events that have taken place are creating symptoms that are going to need some level of intervention at some point.
Can that sometimes be experienced by, say, a spouse? The spouse knows that something's getting in the way.
Right.
Is that
Sure.
sometimes family members are the ones pointing it out?
Sometimes we don't see the things
Right.
in ourselves that
Yeah.
others see in us.
Yeah.
So that's it's
Yeah.
always probably a good thing to listen to those who know us best.
Yeah.
But that would absolutely be one way, by listening to others. And so I think if your life becomes unmanageable, or the symptoms get to a place where you aren't able to continue your daily functioning
Yes.
at your peak level or your best, when your daily functioning begins to go backwards or slide down, that would probably be another really good indicator.
So, for the most part, do all counselors and therapists know how to treat trauma?
It depends.
Okay.
Sometimes you have different trauma. So sometimes you have single trauma. Sometimes you have multiple trauma. Sometimes some individuals may have experienced multiple events that
Right.
create multiple traumas for an individual, and some may have one. Typically, you're going to be able to ask a therapist, or an individual watching would be able to ask a therapist if they have experience treating trauma. And those who have are going to tell you that, and those who haven't are probably going to identify that there may need to
It's not
be a
their
referral.
specialty.
Right. And they may help you and assist you in referring to someone who does specialize in trauma and is able to do things in different ways other than potentially talk therapy or just listening to the things that people have to say, because there's oftentimes a little more to being able to help someone through those traumas than that.
Than talking about it, which could work for some, but not
Absolutely.
for all.
It can certainly work for some people. If the trauma has had a long history of, so in other words, if it happened many years ago, or if it's a very, very big event or difficult situation, oftentimes there are some other ways outside of just talking about it that typically need to occur to really clear that trauma.
Yeah, it's got to be relieving if anyone's listening to this and they know that they have suffered something that would be in the category of trauma. It's affected them, emotionally, or it's affected them in their relationships. It's got to be a relief to know what you said. Trauma is treatable, that they don't have to keep on suffering with that there are ways to work through it, right?
Absolutely.
Yeah. So the first thing you do, I'm wondering, is it something along the lines of creating this trusting relationship with this person so that they are able to open up and share whatever this thing is, this trauma?
I think they have to find someone that they can trust,
Right.
find someone that they can connect to, find someone who they believe can join them and walk together with them through a process of healing, and who can educate them about that process as they go through it.
Yeah, I wish I had a trauma right now that I could give you, because I think we could demonstrate how you deal with, how you work through
Sure.
that with someone. That would be really great. All right, so there's a lot of resources out there for them, for anyone who's wondering if this is something that they need help for. Do you have an idea or a suggestion on where they begin? Because there's not just one place that they would have to go, that there's plenty of different resources. Am I right on that, or close?
There are
Okay.
many therapists and licensed professional counselors or licensed marriage and family therapists that are going to identify that they specifically treat or address trauma. So
Okay.
most licensed professionals in the mental health field are going to be able to list that those are things that they specialize in or identify working on. One of the things that anyone can access is an EMDR website, and it's called EMDR HAP, which is Humanitarian Assistance Program, and they have a Find a Clinician, I think is the link, and you can go in and put the area in which you live, I think it's zip code or the county maybe, and it'll pull up those who are certified and have gone through specific training to provide specific trauma treatment. And that's a pretty good way to be able to identify people that might be available to do those things in every person's area.
So this is an area that you spend a lot of time in, working as a program manager at the Mental Health Cooperative. I would imagine you have a lot of clients that come in that have suffered trauma, and then you supervise clinicians who are working with them. Is this an area that you teach and supervise and coach?
Supervision for individuals struggling with trauma and those that are working with them is something that I provide supervision virtually on a daily basis. Just what we know about how vast trauma is, and really the definition just widening what we originally thought, oh, there's just a small few who have experienced trauma, when you really understand what trauma is, which is really an emotional difficulty from an event that occurs. There's so much trauma out there that it's something that almost happens on a daily basis.
Wow. I bet there's more of us that have that than we even realize, and we can have great relief from it.
With everything that's happening in the world today, we're probably all more susceptible than ever.
Yeah. Well, you really know a lot about this, and you have no idea how much I appreciate you being here.
Thanks for
I
having
know
me.
that you rearranged a lot of things to be here to share your knowledge about trauma and just working with trauma and what that's like.
Thank you for having me.
So, yeah, it's good to know that there are people out there like you, and that you're supervising and providing so much information to other counselors and therapists as well. So, I want to say to our viewers that we're so glad that you are here with us today, and that you got to hear I think probably just a little snippet, am I right, Clay, of all that there can be about
Sure.
trauma. You got to hear how he works with trauma and how he teaches and how he supervises those therapists, counselors who are also working with trauma. So it's you've got a lot of insight in here, and it's unique in that we get to know how our counselors and therapists are working with clients. So if you do have trauma, Clay has shared some ways that you can get help, seek a counselor therapist, ask if they have a specialty in that area, if they work with that or who they know, or you can go on the EMDR website. So I want to say thank you so much for joining us today. Thank you for being with us.